All right, so for this video, we're doing an IM injection. All right, so my patient, Mr. Jones, I got I'm at the patient bedside, at the patient's door. I'm gonna look at the orders and then look at the MARS. The doctor has ordered a IM injection for Mr. Jones. Go through the MARS, look at the medication, check their medication, the route, the dosage, the time, and the patient. Okay, you go in there. Hey, Mr. Jones, I gotta give you IM injection for that pain that you've been having. It's gonna be in. We're gonna give it to you in your deltoid. Okay, it's gotta be IM injection. Okay, patient agrees. I check his armband. Can you tell me your name, your date of birth? Patient, give me the name and his date of birth. I said, all right. So go wash my hands, put on some gloves. So I got my gloves on, and from there I go back to the patient. And there, Mr. Jones, like I said, I give you this IM injection. Got the pain medicine right here. From there, I just gotta look at the medication, look at the MARS, look at the order, make sure it matches with the right patient. And then for any time you give medications through a valve, just check the expiration date. Okay, this one is not expired. All right, Mr. Jones, we're gonna give it in your deltoid, okay? Patient agreed. So your deltoid is pretty much where your shoulder's at, and three fingers down. So it'll be like, let's see if I can explain it. Here's his shoulder. I don't have to do 3 fingers, and typically around right here, because you kind of have to like get it taut, kind of like a Z pattern way. You pretty much want that skin to be really tight. Okay, you want it really tight when you do IM injections. You want to make sure you hit the muscle, not the vessels. But anywho, so got the medication. I verified it 3 times already, and then if I was to get this medication ready at away from bedside, when I draw it up, I'll make sure I put like a label on my syringe. But we're at the patient bedside. We confirm it's him. We looked at the MARS, the orders, make sure we get the right drug, and we're ready now. So I already cleaned it. And the circular immersion is already air dry. First thing first, I don't need this. You gotta get your syringe, and typically you'll get a blunt needle. So when you get the medication, it doesn't affect the your outer gauge needle, because sometimes they'll bend it, or it won't be as sharp, and it'll be more painful for the patient. But for this video, since I don't have a blunt needle, I'll say this is my blunt needle. Yes, I have gloves on. All right, so since it's already open valve, I'm gonna clean it with alcohol pad. I'm gonna let that air dry. Okay, this is my blunt needle, like I said. And let's do 1/2 ml. That's what the order was, 1/2 ml. Straight down, inject the air. Turn it upside down. And then now you just gotta get the 1/2 ml or whatever, you know what the order is. Okay. Once you got the 1/2 ml, you would, let's see how to do this. You would, of course, remove the blunt needle, and then put in your 25 gauge by 1 inch. All right, Mr. Jones. So I got your IM injection ready. Can you tell me your name, date of birth? I'll look at his armbands, correct. Look at the MARS, look at the orders. It all matches with the patient. I already cleaned it. I got my gloves on. I really don't like that. Anyways, I got my gloves on. through the, like I said, that 3-finger method to confirm the right placement, like I showed you a while ago. And then from there, like I said, like this, for instance, would be his shoulder, and we already have it nice and taut. You go straight in, and then you'll aspirate. Make sure you don't get no blood return. And then from there, you inject. And it's like it's going to be 10 mils a second, if I'm not mistaken. And okay, so once that's done, once you administer your medication, you come straight out. You'll put this in the sharps container. You throw that in the sharps container, and you'll just wipe it again with an alcohol pad. But that's mainly it when it comes down to giving IM injections. Just make sure that you always aspirate, make sure you don't get no blood return, and then you go nice and slow with the medication. Then you have different sites that you can give the patients. You have the vastus lateralis. It's pretty much the outer thigh portion of, it's pretty much the outer thigh portion. The way we learned it is you put like a hand where your hip is at, and then a hand above your knee, and it'll be the outer portion of your thigh. It's not going to be the inner portion. It's going to be the outer portion of your thigh. I don't know how to just demonstrate without a dummy, but that's the best way I can describe it. There's your hip, your above your knee, and then so that's pretty much that. And then the outer thigh, not the inner thigh, but the outer thigh. Now for the ventral gluteal, yeah. So let's say, for instance, the patient needs a IM injection of ventral gluteal. You can tell them like, hey, all right, lay on your left side, and then remember where the hip bone is at. How can I better say it? The hip bone area. See, that's to the left. Okay. You kind of have to like put your hand on there, and then we'll place your palm, I guess what it's called, truncal, in the index finger and the anterior superior iliac spine. Yeah, that's a mouthful. And then you're gonna have to kind of like spread your fingers. It's kind of hard to describe it without having a proper dummy, but you spread your fingers, and same thing. It's kind of like it to be that V area, and that'll be kind of like your target area to inject it in that area. And you do the same process. You'll clean the site. You'll verify with the medication order. Same thing that I just showed you with the deltoid injections. And you always make sure you aspirate or you pull back on your you pull back on your needles. Make sure you don't pull back any blood. And then same thing when you menstruate, just go very slow. 1 mil per 10 seconds, if I'm not mistaken. And then once you done that, you hold down. You won't take out straight away. You'll hold down for another 10 more seconds to make sure it gets into that muscle. And yeah, that's pretty much it. That's it when it comes down to IM injections.